Hi everybody, my name is Dr. Cecilia or Cecille Saulog Bato. I'm a nurse practitioner by profession and I do have a doctorate degree in health administration. Tonight I will discuss to you about an innovative wearable device called the Helo. I'm going to explain to you how it works in simple words, so sit back and relax and enjoy this presentation. Thank you. So let's continue on with our video presentation about understanding the Helo. Okay, our first slide shows the Helo, which is the most advanced wearable technology in the world. It's actually featured in magazines and a few television shows. It's skyrocketing right now and everybody's talking about it. Now, Helo stands for Health and Lifestyle Oracle, and this is our latest model, which is the LX. It has several different color bands, which will go very compatible with your outfit, so very fashionable, right? This is the Helo wristband. It's made up of a hypoallergenic silicone band that can house the germanium stone and the Himalayan stones, as you can see in this picture. Now, this is the Helo brain. The Helo brain is the Helo sensor, and I call it the brain because that's where it all starts. Now, the principle behind the Helo is the photoplethysmography, which is, in simple words, PPG. It means it's one of the simplest techniques that can be used to detect blood volume changes in the microvascular bed. So when the Helo sensor touches the skin, it detects and reflects the amount of scattered light, which is called the direct current, and the light signals perceives the variations in blood volume. And the variations in blood volume is actually depicted when the heart pumps blood and the heart squirts blood all over the body, and there is the systolic and diastolic changes that occur. So variation in blood volume signal is transformed into waveform or current, which is alternating current, in the photodiode, which is the processor or a semiconductor device that converts light into current. The current is then translated into estimated real-time readings such as your vital signs, mood, sleep, and all the special features that the Helo has. And finally, the data is then transmitted into our smartphones. Now, just a graphic illustration of how the Helo works. It starts with a sensor touching the skin, and the light travels through the biological tissues absorbed by bones, skin pigments, and both venous and arterial blood. And that is what we call the direct current. Okay? So when the heart pumps blood, we have the systolic and diastolic phases of the cardiac cycle. In the systolic cycle, we have the maximum blood flow, which is depicted by the increased intensity of detected light. And the diastolic phase, which has minimum blood flow, it is perceived as increased intensity of the detected light. That is because blood absorbs more light compared to the surrounding tissues, and a reduction in the amount of blood is perceived as an increase in intensity of the detected light. However, the voltage signal from the sensor is proportional or proportion to the quantity of blood flowing through the blood vessels. And the data is then transformed into our cell phone, such as our Android or iPhone, and it shows us our real-time readings. Okay? Very simple. And with that, I would like to close this presentation. If you want a more detailed explanation of how the Helo works, just refer to these references. Thank you so much for staying with me, and hope you learned something, and just go get your Helo. Okay, thank you so much and have a good night.